Hello, it is Wednesday. Oh wow, I'm exposing myself. Okay, it's Wednesday, January 29th, and I'm alone today. That's why I'm taking a mirror selfie. I decided to give my family and boyfriend a break. No, it's just an appointment with Dr. Boileau. No chemo, no test, nothing. So I told everyone it was cool that I come alone. I'm just gonna find out the details for the mastectomy, which is, like I was telling you guys yesterday, the same day of reconstruction, the details I said about Dr. D. So now I'm gonna meet Dr. Boileau, and he's gonna give me all the details about mastectomy. And a question I have for him today: radiation. I want to know if I'm actually going to need to do it, and what he thinks the chances are, and if so, what my days are going to look like ahead. So I will promise to keep you posted. See ya. Hey guys, just got home from my appointment with Dr. Boileau. It's still Wednesday, January 29th, 2014. And so we discussed my mastectomy. And basically, what Dr. Boileau is going to do on February 13th, 2014, yes, the official day of my surgery, he's going to be in charge of the removal of my entire left breast, right? But what he's also going to do is a sentinel lymph node biopsy. And what that's going to determine is whether or not I still had cancer cells in my breast, but more importantly, in my lymph nodes, and if so, where in my lymph nodes. And so, technically, when they already remove my entire breast, I should be cancer-free in terms of, like, the breast area, because they're removing everything, and my cancer was local. It did not metastasize. It is nowhere else in my body. Therefore, as soon as my breast is completely removed, I'll be cancer-free in the breast. However, when I was first diagnosed, I did have a tumor in my armpit, my lymph node. And so the only way of knowing whether or not it's still affected, because I had a complete clinical response with chemotherapy, you can no longer feel anything, but to know whether or not there's still microscopic cancer cells left is by doing the sentinel lymph node biopsy. And so those results, Dr. Boileau will be doing it during the mastectomy, and 4 weeks later, I got this picture. By the way, all the details of my surgery, scribbles and highlights. It's complicated stuff. Anyways, a new date to remember, March 14th. And that date is pretty much when I receive the results of my pathology, and that will determine whether or not I am cancer-free. So that day I am praying that everything's gone, that there's not even a single microscopic cancer cell left. If it is positive, then unfortunately I have to do another surgery in the lymph node, and of course radiation will be 100% necessary. And if it is negative, then I'm cancer free. It's the beginning of my new life. I'll have to do reconstruction and everything later. Yeah, that's just the aesthetics, but no more surgery for my lymph nodes, and possibly no radiation. But standard procedure requires radiation because in my first diagnosis I had cancer in the lymph nodes. So it'll be a 50-50% chance whether or not I have to do radiation for 5 weeks, total of 25 rounds. And the only time we'll have that discussion of whether or not I am or I am not going to do radiation is if my pathology reports to be negative. And that's what I am praying for, March 14th. Big news. So yes, that's pretty much what we discussed today. But there is so much information, and there's so many things I need to know to prep for my surgery the day before Valentine's Day. And so to all the ladies who are also diagnosed with breast cancer and who are potentially going to get a mastectomy, I promise to keep you updated on every single step and procedure that needs to be done, from my pre-op tests to having to wash myself with a specific disinfectant, Salinex soap or something. I think that's what it's called. Yeah. I will bring you guys with me, because we all know when our doctors talk, and as many as questions as you can ask them, it's just still confusing. So I'm going to try to give you and deliver you those steps in a concrete way, and so you guys get a better idea of what it's like to have a mastectomy. All right.